I think smelling the roses, taking time out with friends, family, and just, understanding, how precious, your family, kids, and next to, God and family, everything else comes second. And you just have to remember that.
Hey, it's Rocky. Welcome to Richer Soul. Today's guest is Dr. Baktari, a physician who will discuss the state of medicine. Imagine it's 12 months from now, and you've achieved your major life goals. How does it feel to be in the best shape of your life? To wake up energized, excited about the day? To have great relationships and friends who support you and propel you forward? How does it feel to have an excess of money, to be able to make the choices you want? To be fearless and open to trying new adventures? Imagine being connected to the universe and it providing everything you desire. It's possible over time, and your past does not dictate your future. The only thing holding you back from this vision is you. It's time to take control of our thoughts and use them to our advantage. Welcome to Richer Soul, where we achieve our dreams and create harmony to health, wealth, relationships, time, and spirituality. If you have not had a chance to listen to episodes 1 through 9, I encourage you to go back and listen to the framework behind Richer Soul and how to create the life of your dreams. You can also find all the show notes for this episode at richersoul.com. Today's quote comes from Marcus Aurelius. You have power over your mind, not outside events. Realize this and you will find strength. Let's face it. We can only control ourselves and not the world. The sooner we realize this and stop trying, the easier life becomes. I love Stoic philosophy. Today, we're going to focus on the business side of healthcare and understanding how the money influences what you were told. Most doctors are no longer in private practice. They're now working in corporate medicine. And I don't care if they pretend that that corporation is a nonprofit entity. Many of them are, yet they don't act like that. The incentives have changed, and if you don't understand the players and how the money is flowing, you may not get the answers you were hoping for. I spent decades inside the system, and so I've seen it from many different angles. I want you to have that awareness so you can focus on getting educated and advocating for yourself and for your family. Jonathan Baktari MD brings over 20 years of clinical, administrative, and entrepreneurial experience to lead the current E7 health team. He's been triple board certified physician with specialties in internal medicine, pulmonary, and critical care medicine. He's been the medical director of the Valley Health System, Anthem Blue Cross Blue Shield, Culinary Health Fund, and currently is the CEO of 2 healthcare companies. He's also served as the clinical faculty for several medical schools, including the University of Nevada and Touro University. Let's meet Dr. Baktari. Welcome to Richer Soul, Dr. Baktari. It's great to have you join us today.
Oh, the honor is all mine. Thanks for having me.
And I'm excited to learn from you today. We always like to start at the beginning. What was it like when you were growing up, and how much did your family and school teach you about money?
It's ironic. I don't think it was a lot because money just didn't seem to fall into the equation. I remember, honestly, I think I was 25 years old when I found out what a BMW was. And it's so funny because I talk to 10-year-olds and they know it now, but I know it just seemed like a different time, a different era that, as long as there was food on the table and, there was a car and a house, and that seemed like all you really needed. So it really wasn't, I don't recall it being a big part of my childhood. I mean, we didn't have a lot, but we weren't struggling. So I think it was, very typical sort of immigrant, first generation experience where Um, money is not that important. At least it wasn't when I was a kid.
I would think as an immigrant, it would be, in the sense that we've got to figure out how to make it happen, right?
Well, I mean, we're lucky enough to make it, we're okay. I mean, we weren't not affluent, but we were okay. My dad was a doctor. He just come here. So he did struggle and whatever. But, I don't recall us, in retrospect, I know we didn't have a lot, but it didn't seem that way back then.
Well, if everyone around you has the same, then you just assume that's normal as a kid, right?
Right. I mean, you weren't like watching YouTube channel of, people in their boats and Rolexes and, so you just didn't even know it existed.
And that is very true. What about school? Any teaching on money there?
No. I mean, not elementary school or high school. No, not a whole lot.
Post-college or post-grad?
No, because when I went to when I was college, I was just so focused on pre-med and passing organic chemistry and physics and just like money. I was just wearing T-shirts and jeans every day, and money didn't register. I don't know if that's typical or not.
It is typical. I think there are two professions especially where it's even more typical, which is kind of funny. I hear from attorneys the reason that they pick law school is there's no math class. But what I find ironic is that healthcare is 20% of our economy, and medical schools and even the fellowship and internship programs almost make money and money conversations a very taboo topic on the medical side, with the exception of dentists. Dentists are taught the business of their dental practice.
Right.
All the rest of physicians are almost told, if you talk about this, it's kind of like, blackball and taboo.
Maybe so, but maybe it's just, I think when you're training, you're just trying to get all that information in and learn it, and to add another whole dimension to it, it wouldn't even make sense. It's sort of like, you're trying to land a plane and someone's teaching you how to land a plane, and then they want to teach you about the finances of the airline industry. You're like, no. I just got to land this plane. So I think when you're in the trenches and your attending is talking to you or your resident's talking, you're like, I just want to take care of this patient. And you don't have, there's so much to incorporate in those few years that if someone tried to throw finances, I'm not saying that I think it should be. I'm just saying that was the atmosphere, that we just want to take great care of the patients, learn, medicine, don't make mistakes, try to, whatever. And it's overwhelming the amount of knowledge you have to get. And if somebody said there's this other category of information you should learn about, 401ks and, stock drip programs or whatever, it just probably wouldn't even make sense in the context. Like I said, landing a plane and somebody wants to talk to you about finances, you're like, let me just land this plane.
Well, I think of it more in a wider perspective. One, let's face it, doctors do have a lucrative career many times. So how do I manage that? Two, and we'll talk about this, in the past, many doctors were in private practice. So how do I run the business of my practice from that standpoint? And then three, I think, is just simply so much money goes into healthcare, is understanding all of that more so from the patient's perspective. And I don't know that patients realize, but again, you're all about taking care of the patient. The money component isn't something that is part of that conversation.
Let me probably phrase it to you in a way that if money was a part of that component, nobody would become a doctor, because
yeah, I didn't mean it from your standpoint. I meant more from the patient.
Right. No, but I guess the point that I wanted to make, which is, I don't think I've shared this with too many other people, but, you think about like, when you're 27, 28 years old and you're starting your internship and you're working 7 days a week, every third night you're sleeping at the hospital and working 36 hours. And so if money was brought into it and someone says, hey, I have an idea. What do you think would happen if you got a job at Apple or IBM and told your boss at Apple or IBM that you were going to work 7 days a week? Every third night you would sleep at Apple headquarters and work the next day on top of it. You would become so rich if you just take a 27-year-old and ask him to do that at Apple or IBM or Uber or wherever. So I think it's a good thing they don't, because if these 27-year-old knew, that what they're doing, they're putting in this and then they're studying when they're not there and what have you. So I think money has to be taken out of it, because otherwise it's sheer insanity why someone would do it. Why would you spend near 80 to 120 hours a week and not be in a profession that, yes, it's lucrative. And yes, there are some doctors that do really well, but, for the average doctor, they do okay, but, they're not going to be Bill Gates or, they're not going to be, anyway. So I think contextually, it just appeals to people who money is not that important. It's a calling from God. You want to help patients, and you don't mind spending 120 hours a week. And that's the way, we all looked at it. So, or at least many of us looked at it. So if money was brought in, the insanity of what we were doing would have probably hit us.
It is a major sacrifice to become a doctor. I mean, between, you go through all the undergrad, and then you've got to go to medical school. Then you got to go through residency. Then you got to go through. For many people, they're not getting out till they're in their early 30s, practically.
Right.
Whereas the software engineer at Google's retiring. So yeah. Right. So that's why the insanity. This is why medicine people. A lot of people are going to medicine. They have just a different value system, and it's not that money was taboo. It's just like it was. We're here to take care of people, and somehow the finances. I'm not saying this is good. I'm just saying this is how we think. It'll work itself out. No, and I understand. I think my original point was around the senses of when you're making a choice of treatment for a patient.
Yes.
The finances aren't so much, and a lot of times I find that doctors don't even know what the costs involved in those choices are, because there's a million insurance plans. They all have different deductibles, different coverages. And so the patient needs to have those kind of financial conversations to say, hey, these treatments you're giving me cost X. Are there alternatives? What other ways can we do this? Because it's a whole nother realm, like you said, that is not part of the conversation that usually happens.
Yeah, I actually, so there's two sides to that coin, if you don't mind me going there. Because on one side, that's already happening, right? If you're in an HMO, or you're in a severely managed care plan, or if you're in Medicare Advantage, for example, you're in any of those, though they're making that decision for you already. They're taking the cheapest, most effective, they've got that down to a science. And now what you're referring to is the, percentage of the population that is fee for service in a real fashion. Yes, there are excesses where doctors order too much just to be safe, or don't look at the cost that the patient will endure. So I think both sides have its excesses. I mean, you can get an HMO where you may not get things offered to you that you should be. It's not even given a choice. Well, but if you're in a more fee for service atmosphere, you may be in this situation where they may not look at the true cost of it, or they may be, play defensive medicine just to make sure they get it right and order tests that maybe, potentially maybe didn't have to have. So I think both sides have their issue, because you can also get to the point where you don't get the care you need. And then you can get to the point where, you get too much care, or, the more expensive care. So I think both sides.
And I think you have to understand who's involved, right? So you mentioned Medicare, in which case the government's involved. They're administering that program. If, depending on the type of insurance that you have, the insurance company's involved, right? They're making choices that may or may not be in your best interest.
Mm-hmm.
Or if things aren't coded the way they wanted them, because there's no standard for half this stuff, then that creates a whole nother problem. And then the other side is who owns the medical practice. So in the past, most doctors were private practice. They ran a business. They had the time to be with the patient. Now what I'm seeing is much more our large systems, corporate medicine. People with MBAs are making decisions about what needs to be done. And doctors are literally getting, beat on to see a million patients a day and try and be perfect in that time, which is difficult. And now I'm seeing private equity where private equity is coming in and buying up some of these, in which case they need a return on their equity. So they change their billing practices, or they do things from a business standpoint that may or may not make sense. And that has nothing to do with the doctor. They're just, they're doing their best as a physician. But I think people need to know all of these things that are going on around them so they can ask better questions.
Yeah, I mean, you hit the nail really right on the head. 20 years ago, about 25% of physicians were employed and 75% were in private practice. That number is now reversed. As of this year, 75% of physicians are employed and 25%. So really the era of private practice is essentially over. So statistically, you're much more likely to see a healthcare provider that's an employee than owning a practice. So I think that's the reality that people have to accept. That, and you hit the nail also on the head, that is really driven by healthcare consolidation. Just like the airline industry consolidated, just like the cell phone industry consolidated. They both went from like 10, 15 companies to 3. Same thing with healthcare. It's just massive consolidation. In most cities now, 1 or 2 big plans have bought up almost everything. And, unfortunately, the level of service that you saw change with the airline industry as they went from 12 to 3, or the cell phone companies as they went from 12 to 3, will probably happen and is happening in healthcare. Their service is going down and what have you.
And so I guess the beginning of that, I always look at my primary care doctor as kind of overseeing my entire process, dealing, if I need to go to a specialist, they can kind of be not so much a gatekeeper, but the referral of saying, I think you need this, or I think you need that. And then communicating with all the different specialists to help ensure that everybody is on the same page and talking back and forth with that. So that comes down to picking a good primary care doctor. And I know you've got a little bit of advice in that area.
Well, yeah, but even before we talk about that, even just in the last couple of years, when people tell me they went to see their primary care doctor, now if you're in a managed care plan, the likelihood that you will see the same doctor, first of all, is getting slimmer and slimmer. Now we have gatekeepers for the gatekeepers. There are PAs and nurse practitioners you'll see instead of your doctor. So even picking the right primary care doctor has evolved because, if you're in a plan, there may be 6, 7 doctors that they may rotate you through, and all of those have PAs and nurse practitioners that may see you depending on what day or what afternoon you show up. But so I think the challenge is that the whole developing a relationship with one primary care doctor is challenging. It's very difficult. It's very difficult to find someone who basically grows old with you, right? I remember when you used to have 1 kid, now you got 5 kids or 3 kids. And I remember when, your wife had this problem or your husband had that. Less and less of that is occurring because of what you said, the corporate medicine. And yes, to pick a primary care doctor, it's very, very important to ask the kind of questions that, hey, will I be seeing you or will I be seeing a lot of different people? How easy is it going to be for me to come see you? What's the wait? Do I have to wait 2-3 months to see you? How difficult is it to communicate with you? These are all the kind of things that people have to look at in selecting a primary care doctor. But it's on some of my podcasts, what I talk about is before you even select a primary care doctor, now you're actually forced to select the system. Oh, I'm going to use that system. And within that system, then I got to find a primary care doctor. So unless you're part of the 25% that is fee for service and you're just picking a doctor, more than likely you actually pick a system than a doctor. Does that make sense?
It does. I've always been on the PPO side, so I've always had freedom of picking individual. Like, we didn't have to stay within systems as long as they were part of the plan, which most people in our area are part of a plan. We haven't had that limitation. And I've been with the same primary care doc for, I think, almost 30 years.
Right. Now that's the exception. You are the exception. That's not the normal experience currently today. Just because if 75% of primary care doctors are employees, you can imagine the likelihood that you'll have access to them for 30 years is going to be a lot smaller.
It is going to be a lot smaller. And I think, but this is where patients need to take ownership, because if you're, if you're going in for any kind of a condition and you're in there every couple of months and you're looking at a different person, are you making sure that they are up to date on you and your particular situation and what you're experiencing? I don't know how doctors do it. I mean, if you've got to see a new patient every time for a chronic condition, how do they even have that continuity of care?
Yeah, because you got to understand, 1/3 of all primary care visits are about nothing, meaning they're about reassurance. So I think statistically that holds out. So if you're seeing 10 people and you're a primary care doctor, 1/3 of them are there just to see your face and you tell them nothing is wrong. Now, part of figuring out who that third is because you have a relationship with them. So, when Bill comes, he must be stressed out. I know he's going through something at home, blah, 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 blah. Now, you're like, well, we got to get a CAT scan on that. I don't know what that. In other words, I'm exaggerating the point, but what if you know Bill and you've been taking care of him for 20 years and he's going through a tough time at work and he's having a tough time with his kids or his marriage or Susie or whatever, you can factor that into your, sort of algorithm, that we have in our brain when we see a patient with a complaint. When you're seeing just fresh new patients, you lose some of that. You lose some of the benefit and you lose some of the, also the ability to figure out who just needs reassurance and who really needs a CAT scan, right? And it's part of what is missing in those kind of situations.
So what should patients do?
Well, again, I think for a lot of people, they're young and healthy, so it doesn't really matter to them. As they grow older, of course, it's going to matter more. You got to decide. How much, how important is it for you to have a legitimate relationship with a physician, and in your community, based on your insurance and based on the healthcare system around you, how you can navigate that system. At the end of the day, you want to develop a relationship so your doctor can better understand, for example, even your risk assessment. There are patients who, I know really well, and I know that they're okay if we watch something for a while and see how it goes. There are the other patients I know there'll be a nervous wreck if we don't, try to get to the bottom of it. And when I have that information, I may do two different things for the same problem because I know Susie and I know Bill, and I know which one has more risk tolerance, which one is it going to impact more, and many other things. So, you have to find out how important it is to you to develop that kind of relationship, and whether it's through concierge medicine, through other ways of, like you said, get the Mercedes-Benz PPO plan, and then find the doctor that's not an employee, who you're actually going to see, and not, a whole crew of people that you might see. So these are all strategies you can deploy if it's important to you.
And I think one of the things that is coming up for the younger generation isn't so much their health, but they may be managing their parents' health.
Ah, yes.
Sometimes they're local, sometimes they're remote.
Mm-hmm.
And so building that relationship as well.
Yeah, no, I think especially as your parents get older, it's really important to, even know who to call when things come up with your parents and who you can address issues with. And you're right. I mean, on some level, you almost have to develop a relationship with their caretakers as much as they do.
And I think once you're in well, it depends on what kind of Medicare insurance you pick, tells you whether you get more flexibility or less flexibility.
Yeah, I mean, with Medicare, it's really down to Medicare Advantage versus not. I mean, that's really did a whole two podcasts on that. But yeah, Medicare Advantage, you're basically, for all intents and purposes, signing up for an HMO. And all the good and bad that brings, you're getting an HMO, you're giving away your Medicare. The flip side is, if you keep your Medicare, you have more flexibility, but, obviously there's theoretical problems with overusage when you have Medicare because there's no one really often screening how much care you're getting.
What's the best way for people to learn about this? Because this is a big, complex system.
Yeah. You talking about Medicare or just in general?
I think the Medicare choices, since we're on that particular topic.
Maybe you could provide a link to, I did 2 episodes on how to pick Medicare Advantage versus Medicare. One, I interviewed a broker, actually. I interviewed a insurance broker because that's very interesting when you realize, like, for example, a lot of insurance brokers are highly incentivized to sell you Medicare Advantage. They get a much bigger commission. And so, they just talk about, you won't have any co-pays, when you see your doctor, and you'll get free hearing and vision, and, you'll free dental. What they don't tell you is you lose pretty much autonomy and have very little say in your care moving forward. And if you're healthy, that may not be so bad. But and then the problem, if you're like getting in the weeds, is once you pick Medicare Advantage when you're 65, and if you try to switch later, you may not be able to, because to switch later, you have to, get a healthcare questionnaire to get Medicare supplement to cover what you need. So it's a really important decision that sometimes there's no going back if you make the wrong decision at 65.
Today's episode is sponsored by Profit Answer Man Podcast. Did you know that most small business owners hate looking at their financials? It's one reason they may struggle with business success. The Profit Answer Man podcast helps them ensure they are profitable and can pay their employees and weather the storms we all have to face. It's built on the Profit First methodology of pay yourself first. The Profit Answer Man podcast is a must listen to for every small business owner and anyone who wants to help them survive and thrive. Check it out on your favorite listening platform. And I think this is why it's important that people have these conversations, understand what they're up against, and especially with healthcare. I mean, it keeps coming back to the money and the incentives that are out there, and knowing what's going on and making sure that you understand. And that's one of the biggest things that I've always told people. And I learned it because of my dad. This is just my philosophy, never sign up for an Advantage plan. Always go with the Medigap. You are going to pay more, but you have the freedom. And the problem isn't when you're 65, if you're in decent health. The problem is when you're 77 and all of a sudden you need it and it's no longer available to you at that point. And that's where the problems come up. It was amazing. Yeah. He was in the hospital and they said, we have to discharge you from rehab. And he said, no, I have this Medigap policy. They said, oh, we don't have to discharge you. You get to stay. Now, he was in no shape to be discharged, but they go based on what gets paid for.
Right. Yeah. I mean, like I said, I did like a 2-hour podcast on it. And I mean, you just summarized the conclusion, but I mean, how you get there, you have to get to, all the nitty gritty to find out, why it's not often in your best interest to give up your Medicare.
And that's my whole hope today is we open the door so they can go spend the 2 hours and learn more. I bring in the experts. I'm going to open a door. You understand it. If it's an issue that you're going to deal with or you're dealing with, or you've got parents, then go spend the time and learn, but be aware that this is an issue. And I think that's the biggest problem. I don't think people are even aware that there are all of these issues out there.
And the funny thing is the only sense of awareness they get is from the high level of Medicare Advantage advertising. You often see 2 seniors riding a bicycle, smiling or having a picnic, and and the ad says, blah, 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 advantage. And what they don't understand is, this is just a marketing ploy for you to hand over your Medicare to them. And often there is no going back, unfortunately, in certain situations. So you will be in a managed care situation. And the whole goal of Medicare Advantage is really they take a finite number of dollars from the government to take care of you, and whatever they don't use is their profit. So, I mean, that's all you need to know. I mean, if you went to a restaurant, right, and you paid one lump sum, and the restaurant, their whole goal was to give you as minimal amount of food as they could, because the balance is their profit. They're not going to be coming over you too many times and saying, oh, you want another entree or you want another dessert. So it's just when the incentives can be wrong the other way. And I talk about this on that podcast. The incentives can be wrong when it's excess, when they can do as many things as they want to you, when you have regular Medicare. So you have to control that too. So I think that both systems have their issue, but you have to understand what those issues are so you can navigate it.
What are some of the other major issues we should be aware of so that people can dig further in and navigate?
In terms of?
In overall healthcare.
I mean, the big picture really is you got to know where everyone, I don't want to say their financial side, but you have to understand where everyone's coming from. Excuse me. So, when you're in the hospital, you have to understand, what is the hospital thinking? Okay, they have your insurance. What is their motive? What are they thinking? Yes, they want to provide you great care, but on top of that, what is their thinking? Your doctor, who comes to see you, is he a hospitalist who is getting paid by your insurance company? There's a lot of times people don't know that the physician that comes to see them in the hospital is employed by their insurance company. Literally is employed by their. This is so common, and people don't ask. By the way, doc, can I ask you a question? Who pays you? The hospital? My insurance company? Who's paying your salary? Are you just in private practice? And am I paying you this way? If your insurance company is paying your doctor's salary, look, doctors are great people. They're going to do the right thing anyway. But having said all that, do you at least want to know? Do you at least want to know who's paying that person? I'm not saying it's going to alter anything necessarily, but why would you not want to know?
So that's new to me. The hospitalists are actually on payroll from the insurance company?
Many, many times, yes. Yes, they will hire their own hospitalists. In fact, a lot of hospitals either work for the hospital, but a lot of them work for the health plan, or even if they don't, they're contracted. So if you have a certain, if you're a hospitalist group, now they're all groups, and they've contracted with 3 insurance companies, right? Well, if their bed days are up 25%, they may lose that contract because there's another hospitalist group saying, you hire us, we'll get your bed days even further down. right? So even when they're not, which is an issue, if they're contracted with your insurance company, but a lot of times literally they work for your insurance company, literally like their paycheck comes from it. So, and all I'm saying is, wouldn't you want to know at least? Not to say anything's going to be different, but wouldn't you want to know?
It's funny because I spent many years in the drug industry and the whole market has changed. During part of that, certain hospitals got I shouldn't say certain hospitals, certain people got very uptight saying, oh, we want to know where the conflicts of interest are.
Right.
And they would say, oh, this drug company gave them whatever, a speaking fee or this or that. And I would always ask the very simple question, well, if that's a conflict of interest, that's fine. First of all the companies are doing it, so they're conflicted with everybody. But more important, since you're paying their salary and since you dictated the formulary, do you tell the patients that they have a conflict of interest because of what the system told them to do?
Honestly, I don't know why there hasn't been regulation preventing doctors to work for the insurance company directly. I have no idea. I mean, it just doesn't make any sense. You wouldn't allow it in any other field that would even be, you wouldn't want the person taking care of you to be hired by the company that's responsible for paying for your care. I mean, but nobody looks under the hood and asks that question. For me, it's a very conflicted situation. Again, I want you to know most doctors do the right thing. And my experience has been, most doctors and healthcare providers, PAs, nurse practitioners, they're there to help people. Most of them are great people. Having said that, the system that they're in rewards certain behaviors and dissuades other behaviors. And why would you want to be getting care from someone who is in that situation?
And I agree with that. And I think most doctors and most other care providers do an amazing job. They're just stuck, right? In a system where they don't always have voice or they don't have time.
No, they don't have. Well, I mean, you're working for someone. I mean, that, if you're working in the, men's department at Macy's, you're not going to, try to restructure Macy's or, you're just there to get through the day. Yeah.
So if patients want to start taking back control of their health or take a more active role in their health, I'm sure you've probably done many topics on that particular area, many podcasts or.
Yeah. I mean, we talk about it. I mean, one is obviously understand your insurance. If you don't understand your insurance, who owns your insurance? Who's the company? Are you in a PPO? Are you in an HMO and everything in between? And, who you're seeing, where they're coming from, who they're employed by, what's their situation, and then understanding how important it is to you. If you don't have any healthcare problems and your biggest concern is not having a copay, you can have that. Okay. I can't tell you if it's happened to me hundreds of times where I'll even have a young, healthy person who will go skiing and blow out their knees. And they're in an HMO because they're like, well, what do I don't use healthcare. And now, they want to go to Stanford to see an orthopedic specialist because the first surgery got screwed up. And they're like, no, you can't do that. You can't, and so then they're like, oh, if only I had known, I would have never signed up for this. And I think that's the issue. God forbid a car accident, a skiing accident, and then sometimes young people get sick too. So again, it's all, when you're healthy and everything's fine, it's easy to worry about the copay and the monthly payments. And I know, insurance costs are high and people have financial limitations, but you just have to, people figure out a way to buy an iPhone, when sometimes they can't. And I think the question really is, do you fully understand what will happen if you sign up for a severely managed program and something happens to you?
So let's just talk a little bit more about what you do as a physician. What's kind of your role and what do you do?
So, I sort of evolved from clinical practice into administrative medicine, and then subsequently into sort of this healthcare, setting up this couple of healthcare companies. And our goal has really been to learn from the rest of healthcare and try to, avoid some of the mistakes. And, what we decide to do is really, we started an adult vaccination company, 12 years ago. And our goal was to really, try to get into a portion of preventive health and wellness that nobody was really addressing. I mean, we were almost like a COVID company before COVID hit. Our goal was to vaccinate adults and everything around that vaccination. And, I think for the CDC, there's about 50,000 vaccine preventable deaths in the US every year. So it was really, I thought, a really good thing to try to attack and grow. And then we wrote a lot of technology and software around how to deliver that care. And that's really been the focus of our, company.
It's funny. I think a lot of people think that the future of healthcare, in other words, the new treatments and so forth, are going to come out of the pharma companies and the biotech companies. I think more tech companies are the ones that are really going to change the game in healthcare because they're not stuck in legacy mode. They have all the frontiers wide open to them.
Yeah, I mean, I think the common theme I see in technology advancing in healthcare is, the fact that insurances are involved because most of that technology has to address them, has to address maximizing reimbursements. And that limits, Amazon's technology is not based on making a third party happy, right? Amazon is like, okay, you and me, what do we got to do to make this work? Okay, so you spend as much money with me as possible, and I give you as much service as possible. That's all we got to do. With healthcare, it's not you and the patient necessarily. It's you and the patient and a third party, whether it's private insurance, government insurance. So writing technology is not as clean when there's only two people involved. I'm sorry, when there's three people as compared to two people involved. So I think there's a reason why, Amazon has better software than your doctor, right?
Well, unfortunately, and that's one of the big things, information in healthcare is not easily and well shared. In other words, if I go to this system and I get an MRI, and then I go to that system, they want to do a new MRI, right? They can't get the data from one to another. And that was supposed to be solved technically with Obamacare and making information more portable, but it hasn't happened. And the funny thing is, most of these systems are all using the same devil of a technology company behind the scenes for EMRs.
Yeah.
And that company's created their own stranglehold on everyone that you can't get the information you need and share it. And I haven't kept up. Are there new frontiers in being able to share data or let the patient take ownership of their data?
I mean, I hate to sound cynical, but who's going to monetize that, right? I mean, most advances, occur because there's a way to monetize it. Who's going to monetize the fact that Stanford and UCLA's, electronic health records can talk to each other? Yes, it makes sense, but where is the incentive for that? And, you can say government intervention, blah, blah, blah. But, this is again, when you have insurances to deal with, and that's your main focus, then portability of data becomes, it's an issue that, you don't have to necessarily address. Although it's getting better within systems, like if you're part of a citywide system, they all have software now that you can log on and, you're seeing your primary and your orthopedic surgeon, you can see everything. But that's within systems, but from system to system is where the challenge is.
And so you just kind of talked about that. How do we make sure if we're in a situation where we need to work with multiple doctors, how do we get them all on the same page?
There lies the challenge. I mean, it's a challenge. I mean, I can tell you anecdotally, I've had to step in for friends and family and call the primary care. Hey, I just want to let you know this is what the orthopedic's saying. But I have that advantage of, being able to get access to those doctors and then, be the middleman to communicate the data. But so I see what you're saying, because the challenge is not everyone's a doctor. Not everyone has a friend who's a doctor, and, and who's going to run interference and communicate and be there. So I had a friend of mine who, has Crohn's disease and changed insurance and couldn't get his very expensive Crohn's medication for months and became sick. And, I had to talk to his GI doctor, call his insurance. But not everyone has that kind of advocate, because I don't think the GI doctor would have answered my call if I wasn't a physician. So for me to call him and say, hey, look, blah, 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 blah. So yeah, it's a challenge. It really is a challenge.
I just heard this story recently, and it's hilarious because it was a Crohn's patient where the doctor called the insurance company, and the insurance company's denying it. But the problem is the person denying it is an OBGYN. Right. So how do you put an OBGYN in charge of Crohn's disease and understand the situation? And this is what we get. And I'll be honest, I saw the same thing when my dad was in the hospital. He's dealing with asthma, diabetes, heart condition. Each of these three people have their own goals, and they just kept throwing more and more stuff on. Well, his glucose is high. Well, his glucose is high is because you're giving him prednisone. But you need to give him the prednisone because that keeps him breathing. It deals with the asthma. So let's get that taken. But then this one wants to take it off because it's affecting this area. And I'm like, if you would all calm down, give him some decent food to eat. He's not eating, not because he doesn't want to eat or because they bring in a chewing specialist. Maybe he can't chew No, your food sucks. I bring in food from outside. He eats well, right? And literally within days of him leaving the hospital, I'm like, we're not putting him on insulin. We don't need all of this. He was off his diabetes meds because you're in the hospital, you're stressed, right? So of course your sugar is going to be high. Of course this. And the whole thing started because I'm like, you're not going to a hospital where you live. You got to come to a hospital where I live because I know how to pick up the phone and call people here. His surgeon's mad back, where he lives because now he has no control. And I'm like, but you weren't going to take control and ownership. Right? So you have to learn this stuff.
So you've been in the thick of things. So you get it.
Oh, I get it very well. Yeah, I mean, I've been in the thick, even with my wife's mother, we were in the thick of it with cancer treatments.
I'm sorry.
And thank you. But just even the nurses on the floor, like you said, every day there's a new nurse on the floor. Every day you've got to repeat the same information to the next nurse. Every day you have to explain the situation. And if you don't have an advocate who will stand up and do that, you're screwed.
And part of what you just said, you have to become an advocate for your relatives, and you have to become an advocate for yourself. So it has to be that way.
Is that what a concierge doctor does? Do they become the advocate more so, or do we need to create something new?
I think the more consolidated healthcare gets, the less personal the service will get, which will leave an opportunity for an industry that fills that void. So whether it's concierge or some version of it, just like in England and in Canada and countries where, it's more socialized, you develop a sort of a black market in a legal way where you get what you're missing. People are always willing to pay, some people are willing to pay to, sit in the front of the plane or, whatever it is. And if you make the back of the plane uncomfortable enough, you'll develop a market for the front of the plane.
Business idea. Honestly, because I see this on the other side with businesses. For example, there are companies that will come in and help them cut costs. And what happens is they negotiate with AT&T once and they see what they can get. When you negotiate on behalf of 1,000 businesses with AT&T, you start to get really smart. It would almost be nice to have people come in whose sole job it is to negotiate with the system, negotiate with the insurance company, and know, hey, this is how we get through the system, and have speed dial to the appropriate people to say, hey, XYZ, you need to do this for my guy because he's on, kind of creating that kind of system within the healthcare system. It's not so much the concierge doctor as much as it is the concierge care of a case manager who can fight the entire system and knows what to do and how to dig into page 386 of your insurance policy and say, this is the exception. You need to make it because of XYZ.
Right. No, you're right.
Well, maybe it's a new business idea for you. I know you always like to go with
No, we got a full plate, but I'm sure somebody will do it.
Somebody hopefully will do it. Any parts of healthcare that we should have touched on that we didn't get a chance to?
No, I think, the major parts is really understanding globally whenever you're interacting with a component of healthcare, whether it's a hospital, an insurance company, a doctor, a hospitalist, just understand where they're coming from. It doesn't mean that in any way it's bad or anything, but just understand, I did a podcast on, how to manage landing in an emergency room. And part of that was just simply understand when you get into the ER, who is everybody? What's their role? What's their, what's driving them? And not to say, they're not going to do, they're not going to give you the best care in the world, but it helps to understand who everybody is and where they're coming from, no matter what situation in healthcare you are, so I think it's incumbent on you to understand where that institution, whether, you set a rehab facility, I have to tell you, there's insurance companies that own rehab facilities. Okay, so you think your doctor works for your insurance company? The rehab place he's sending you or she's sending you is owned by the insurance company. Own physically, like they own it. Like you're the same people that give you that insurance card own the rehab facility. And if you don't know that, it's like the one thing that people know who owns their car and who fixes their car. But this lack of transparency about who people are, who owns this facility that you're transferring my dad to? Like who owns that? Is it just a private place that contracts out? How do they get paid? Do they get paid? There are some people that get paid based on their utilization, or they get rewarded, or whatever. What are those utilization incentives? I'd like to know. I mean, right? I mean, what? So I was just saying, ask those questions, find out what is going on behind the scenes.
I know ER docs, they all have the same word, Gomer. Get out of my ER.
Yeah.
Right? That's their job. How quickly can I get you out of this particular place?
Well, no, that's not actually even true. No, think about that. They're highly incentivized to admit you, not to get you out. Because there's liability if they let you out. There's almost zero liability if they admit you, because you were admitted, even if they got the wrong diagnosis. Well, but we got them in the hospital. The rest of the doctors should have figured it out. If they let you out.
And by out, right, I mean out of the ER. It could be into someone else's bed and someone else's problem.
Right.
But at least they're out of.
They want to triage you and move you along to open up the bed for someone else. But, there's a high incentive to try to admit you if they're not sure what's going on.
Correct. And that's the other little secret is if they discharge you too early, go to the ER quickly, because most insurance companies and most government will not reimburse the hospital for the readmission. Yeah. So it's a kind of a way to stick it back when you have to.
Right. But it's interesting. But some insurance company tell you to go to another ER just so that it's called a bounce back. So they don't get dinged for a bounce back. But anyway, that's a story for another podcast.
We always like to get people to take action. So what's an action step people can take this week to maybe improve their health or their life and take a step forward?
Well, first of all, please get your yearly physical. I think a lot of people think they're too young or whatever. Just get a yearly physical. Go see your doctor. By the time you're 40, you should be getting eye exams. By the time you're 50, your colonoscopies. There's preventative vaccines that you need to get as adults. Your tetanus shot every 10 years, your flu shot annually. There's a lot of maintenance that you need to handle. And I think people in their 20s, 30s, and 40s often think only when I get sick. But you need to, just like maintain your car, maintain your watch, whatever. It's the same thing.
And that's very true. I've been going for physicals for decades.
Good.
Yeah. Well, I have bad eyes, so I have to go to the eye doctor all the time.
Yeah.
Now that I have LASIK, it's better, but you go to the dentist, you do all the preventative. And I think a lot of people are afraid to do some of the preventative, and you just got to. If I want to live long, then I got to do my job to take care of the preventative side.
I love it. Yes.
It's time to learn the secrets of life. What's your secret to living an abundant life?
I think smelling the roses, taking time out with, friends, family, and just, understanding, how precious, your family, your kids, and next to, God and family, everything else comes second. And you just have to remember that.
So true. And I think as a physician, you are probably more apt to see death than many of us do, in the sense you realize the shortness of life.
Yeah. It's very fleeting.
It's very fleeting. What did you learn later in life that you wish you would have learned sooner?
I think what I just said to you first, I wish I had the clarity of what I just said to you, when I was 25.
And realizing, when we're young, we think time is irrelevant. And
right.
One day we blink our eyes and we're not young anymore.
Yeah. And you got to smell the cappuccino,
That you do. If you were to give an 18-year-old one specific piece of wisdom, what would it be?
I would say whatever you're thinking at 18, if you could go in a time machine and speak to your 28-year-old version of you, you'd have pretty much nothing in common. And you have to know that. What you want at 28 is often nothing like what you want at 18. So be careful how many, really concrete plans you make at 18 about your life, because your 28-year-old version of yourself is not going to like some of it.
It's funny, in the Harvard grant study, they followed those people from 18 to 80. Every 10 years, they had these conversations, and it was amazing how much things changed at every 10-year interval when they had those interviews of priorities and what they wanted and everything else that occurred.
Right. So don't make tough decisions at 18.
If people would like to learn more, figure out their healthcare, listen to your podcast, what's the best way for them to find you?
Yeah, well, of course, my podcast is on Spotify, Baktari MD, and all the other platforms, or YouTube, Baktari MD on YouTube. Also, go to my website, baktarimd.com, where we have a lot of our media stuff, our shows, our podcasts, and if I've been featured in other podcasts like this one. So, yeah, it's a great place to kind of, if you want to really understand healthcare and the inside scoop on healthcare. It's those are all good places. Also on LinkedIn, if you want to look me up, it's Jonathan Baktari on LinkedIn is another place you can reach me.
And we'll put some links in the show notes. Thank you so much for joining us today.
Thank you for having me. It was a lot of fun. I really enjoyed it.
Was this what you expected? I recently got a large bill and I was surprised, but then I found out that the doctor had sold out to private equity. All of a sudden, it all made sense. It took multiple phone calls and a letter to get it straightened out. If you don't understand your insurance, your coverages, and you don't challenge the system, you may end up with a lot of expensive bills. It is a constant struggle that we go through, and it takes months before most of this stuff gets figured out. A lot of people ignore it and they get themselves in trouble. The appropriate thing is to pick up the phone and start having phone calls with insurance, with the providers and everyone else, and get it all straightened out. I will say, I'm not going back to that doctor. I don't want to deal with private equity when it comes to my health care. Once you understand how the money flows, you can better understand why you're told what you're told. We do great with emergencies. We don't do well with long-term chronic care. Much of that is actually tied back to the fuel you put in your body. And once again, so much bad information out there, including from our government, who tells you what to eat in the most horrific of ways. You've got to educate yourself, and that's part of what we try to do here. And we will continue to have more people on to show you how to eat better and fuel your body better. If you enjoyed the episode and you know somebody who might benefit from it, would you do me a favor and share with them? I'd appreciate that. Next week, we've got Dr. Allison Kay to talk about how to clear the way to success and how to change our mindsets and the way we look at the world. Thanks for listening. Have an abundant week.